Hello everyone. Today, my team will be presenting from the negative side of the debate topic of Week 10. Companies must protect the health of their employees. I'll focus on the healthcare systems of the United States while the rest of the members will discuss the companies in healthcare in Japan. By the end of the presentation, we hope that you'll be convinced that it is not necessary for companies to protect the health of their employees. The first reason for why it is not necessary for companies to protect their employees is that not only the annual average cost of employer-based healthcare is expensive, there is not enough coverage for all of the workers in a company. This is the graph evidence to show the increasing cost of average annual premiums for a single and family coverage from 1999 to 2018. When the average annual premium healthcare costs increase, the workers who are taking employer-sponsored premium have to pay more for the increasing cost of annual premium healthcare, causing financial difficulties among workers. According to CNBC, the average premium for family coverage has increased 22% over the last 5 years and 54% over the last 10 years, significantly more than either workers' wages or inflation. Here are two graphs as evidences. The first graph shows the percentage of workers who are offered coverage by the employer, and the second graph shows the percentage of workers who actually take the offer of employer-sponsored coverage. In both graphs, FPL means federal poverty level, and basically, the higher the percentage, the less the poverty a household has, and the lower the percentage, the higher the poverty. So the group for under 100% of FPL has the highest poverty level, and 400% of FPL has the lowest poverty level. By looking at the first graph, we can see that the percentage of workers who were offered employer-sponsored coverage has been unequal across the four different groups with different poverty levels from 1998 to 2018. From here, we can see that only 40% of workers in under 100% of FPL group and only 60% of workers between 100 to 250% of FPL group are offered employer-sponsored coverage. Even for the group with over 400% of FPL, not everyone was offered coverage. By looking at the second graph, we can see that among the percentage of workers who are offered coverage, not everyone chose to take the coverage. For example, by comparing the first and second graph, if we look at under 100% of FPL group in 2018, less than 40% were offered and only about 50% actually took the coverage, which means out of 100% of workers, only 20% ended up with employer coverage, and the rest of 80% were without the employer coverage. By observing the two graphs, we can clearly see that there are not enough offers or coverage for all workers, and there are many workers, especially those with low wages, who are left out of employer-sponsored coverage. So in conclusion to my section, I would like to restate that it is not necessary for companies to protect the health of their employees due to the reason and evidences given above.
Now, I will talk about the second reason. The right of life in Article 25 of Constitution of Japan guarantees the people a minimum standard of healthy and current and cultured living. In other words, it provides social security. The people are insured in advance to prepare for the risks they may face in their lives and for the unexpected. The social security system is a system that guarantees the livelihood of the people. Such a social security system consists of four types, which is social insurance, public health, social welfare, and public assistance. The national and local government are responsible for the management of this program, and insurance coverage is compulsory in principle. Labor insurance is included in social insurance, and labor insurance is defined as both workers' compensation insurance and unemployment insurance collectivity. It is based on the labor standards and this was created to support workers and guarantee their livelihood. In this way, we can see that the social insurance provided by the government is already protecting the health of the workers well. There are other free medical examinations conducted by the various company which will reduce the need for the company to intervene. Secondly, there is enough medical care in Japan that there is no need to set up an in-company doctor or in-company consultation service. As you can see in the graph, there are currently more than 250,000 doctors in Japan and over 8,000 hospitals. On the other hand, workers over the 40s are about 51 million in total. If you divide the population of workers in their 40s and beyond who are more likely to have health problems by the number of doctors, 200 workers have one doctor with them. As the table shows, many companies employ far more than 200 employees, which means that the healthcare outside the company is enough. From the above, it is clear that how well countries have healthcare and do not necessarily need an in-company doctor. As the same can be said for in-company counseling. These also lead to reduced costs, which in turn leads to increased company revenue and improved employees' lives, which has a positive impact on fundamental health. Thus, we can see that in Japan, the country already protects workers in terms of constitution, social insurance, and medical care, and it shows that companies do not have an obligation to protect the health of their workers.
I am going to talk about reason 3. As reason 3, we think that companies are already obliged to protect the health of their employees. It is sufficient to fulfill the obligation which are given by the nation, and the company does not have to take any more action to protect the health of its employees. For evidence 1, we use the Japanese labor contract law. Japanese labor contract law clearly states that a company must oblige its employees to work while ensuring their life and physical safety. As obligation for company to maintain proper working conditions such as working hours, break time, holidays, place to rest, staffing, and so on. To do health checkup when hearing worker once a year, regular health checkup, and health checkup for specific business workers. Specific business workers mean those who working late at night or handling harmful substance to the body or in harmful environment. To do proper nursing and treatment in case of illness or injury. To allocate work in consideration of the medical history, chronic illness, and physical condition of workers. It is an obligation already imposed on the company by the Japanese government. However, as long as the company fulfills this obligation, there is no problem in protecting the health of employees. Therefore, there is no need for companies to take more actions than their national obligations. As other evidence, according to Inui 2017, his essay title is Empirical Study on the Utilization and Effect of Health Checkup in Japan, comparing the consideration rate by those who have national health insurance and those who have employee insurance. It was found that the former had a much lower consideration rate. National health insurance is the insurance that is run by the municipality, Japanese government, and employee insurance is the insurance that the employee enter as a company member or the insurance that the public employee has. Therefore, in other words, we can say that companies are relatively able to fulfill their obligations to employee for health yet. As conclusion, we don't think companies must protect the health of their employees. As reasons, we raise these three. Thank you for listening very much.